Welcome to the latest HACSU vodcast, your health and community services union. And if you are an allied health professional, a member of HACSU or not, we need you. We need your help. We need your voice because bargaining will be starting shortly for your new agreement. And to run us through what that means, I'm joined by Sophie Mummery, physiotherapist and president of the Allied Health Professional sub-branch. Sophie, who does this agreement cover?
This agreement is for all allied health professionals who work in the state service, so in the public system, whether that be in the Department of Health, THS, education, justice. We cover about 40 different professions. They're all specialised in what they do, and they work across the whole system from the acute hospital end right up into preventative and community care as well.
Just on the bargaining, a few people have said to me, I work in these areas, but I don't actually know what a bargaining agreement is.
All of the health workers in the public system are covered by an award called the Health and Human Services Award, and that covers the basic things like annual leave, sick leave, shift penalties, those kind of things. And then because allied health have slightly different needs to the other groups in the hospital, we have an agreement on top of that. And that is things targeted specifically to what allied health need in their job and in their conditions. So right now we've got a survey out, so we want to hear from all allied health professionals who work in the public system across the state, and that is giving us a really good idea of what workers would like this round of bargaining. We of course have ongoing issues in allied health that we know need addressing, and so there's some ideas in the survey and we're asking people to rank those ideas, but we'd also like to hear other ideas that we might not have thought of as a sub-branch executive yet. We'd love to hear from everybody's voices about what they want going forward and how that might help address lots of the issues that we have in allied health.
So if you're a member, push the survey into people's faces, seriously, because this could ultimately affect them as well.
Yeah, absolutely. This round for this survey, we want to hear from everybody, members, non-members alike, and capture all of the issues and the wants of allied health and the needs of allied health across the state. Though we know that when we do a bargain that the union's at the table, and so that's members' voices being bargained for. Only members get a say on the final log of claims and what goes into that. So if you've got non-members around you and you're a member of HACSU, please implore them to get on board with this bargain. The more members we have, the more power we have to collectively bargain and get the things we need that allied health are really struggling with right now and get what we need to do our jobs.
We'll put a link to the survey in the comments below. Just on that, I know we can't preempt what is going to happen by the end of the survey and before this bargaining agreement, but what are some of those common issues you expect to see that members are bringing to you already and that you're fighting for that could be a part of this agreement?
Workload pressure and the staffing shortages. We can't necessarily bargain for more positions. That's not something that the agreement covers. But what we can do is really push for clauses that say the government must backfill vacancies when they come up, because we know that when someone goes on holiday or they get sick or they act in a different position, we have these long vacancies because either the government chooses not to fill the positions to save money, or we just can't get the people in time to do that work, or we don't have people with the skills to do that work. And so when the person who's gone on leave comes back, they come back to a really big pile of work to catch up on, and lots of patients have missed out in that time as well. So we're really pushing for a backfill clause to say the government really has to backfill those jobs. We're not desk workers. The work, you can't just put the paper down and the work stops. The work keeps going while we're not there. Wages being nationally competitive is something that we hear a lot. Just for example, my job is paid 22 grand less than my counterparts in Queensland. That's a 16% gap, and that would mean a 16% pay rise, if not more, because we don't want to just be the average. We need to be above it so that we can attract people here. So that's one of our main things, is that we really want pay equity with other states. It is really hard to retain our staff. We have been in a situation where for the last maybe 20 years have been under-resourced and underfunded. The last few years in particular, we've been running at 20-30% vacancies. And of course, patients don't stop coming through the door just because we can't fill our jobs. And that's vacancies that would bring us to full staffing, but our full staffing wouldn't even keep up with the demand that we face. And so workers are feeling really burnt out. We've heard that during COVID and post-COVID. But in Tassie, we were feeling that way before COVID. It's just exacerbated the whole situation. So then we burn out our staff. We see them resign. We see them leave for somewhere that treats them better and pays them better. And then we're left with even more vacancies and more pressure on the people who are left on the ground. And then we build this cycle of even more vacancies. And so we just see our services kind of crumble. And it's going to take a really big investment from the government to kind of stop that vicious cycle. One of our reports showed that we're underinvested by 53% in Tassie in allied health.
What keeps you here and also in that profession?
It's hard because you do feel like leaving and giving up, because it is really challenging and you're watching the system crumble around you. The main thing that actually gives me hope is being active and part of HACSU, because it is a way that we can change and improve things going forward. The government don't listen to us and they don't listen to our managers. So we would tell our managers are very well aware of the shortages and the struggles, and they go, if I could fix it, I would. But the bureaucracy is such that we're not listened to. We'll put a business case up for more staff and we put so much effort into that. And then we don't hear anything, just absolute silence on it. And then kind of hope is lost that we can just keep turning up to work every day and plodding along, seeing the immense amount of patients that we need to see and help. And then there's that moral injury of knowing there's patients that we can't help out there that we should be seeing, but we have to choose between who gets the care and who misses out. And that is that whole vicious cycle, right, of we're in it because we care and we're generally empathetic people. And then we get pushed and pushed and we want to do a good job. So we'll Band-Aid and we'll push and we'll use our own time and our goodwill. But there'll come a point where we just break. And that's really sad, because we need those workers for the long term. We don't want to see them leave the profession. We're taught at uni what the ideal is and what we should be doing in our codes of practice, and our evidence base says we should do one thing, and then the reality of the health system, particularly publicly, means that we can't do what we were trained to do, and we're watching patients not get the care that we know they need.